As healthcare moves away from traditional fee-for-service models, providers need a strategy to stay competitive. That's where Strategic Healthcare Partners comes in. We offer expert consulting and ongoing management oversight for providers looking to form an accountable care organization. From financial feasibility analysis to helping you choose the right ACO in a crowded market, SHP provides the clarity you need to make informed decisions and transition to value-based care. Learn more at shpllc.com.
Welcome to Beyond the Stethoscope, Vital Conversations with SHP. I'm Aaron Higgins. For today's news headlines, Jason shares a report that shows that hospital safety improved prior to the COVID-19 pandemic. But did the pandemic erase all our progress? And I share how workers in all sectors are taking more sick time, but maybe not for the reasons you might think. Then we both sit down with Kristin Woodlock, CEO of Woodlock Associates. For years, Kristin has worked with healthcare organizations as both an advocate and a champion for behavioral health. Kristin now helps organizations work through complex decision-making challenges, develop better methods of communication. Are you ready for this vital conversation? Let's get started. Well, hey there, Jason.
Morning, Aaron. How are you?
I'm doing pretty good. How about you?
Fantastic, man. Fantastic. Good to talk to you again.
Yeah, good to talk to you too. You got some headlines for us today?
I do, yes. A report released just this Wednesday, November 16th by Leapfrog Group. It showed a pretty substantial drop in improvement between 2012 and 2019 in hospital-acquired infection rates and central line associated bloodstream infections, which decreased 43% during that time frame. So there's concern, obviously, that this was through 2019. The pandemic hit, and so lots of chaos and commotion within the hospital settings. So there's curiosity of how that will impact those great trends that were occurring, which Leapfrog Group attributes to adoption of more advanced EHRs, more computerized provider order entry systems, things along those lines during that same time frame, and further federal financial support as well to adopt and advance their EMR systems. But in a nutshell, we have 7 great years of some key data points that show that hospital staff were making the necessary improvements, and it's just a matter of time to show, did the pandemic impact that or not? But time will tell. But yeah, good, positive, influential sort of quality reports card there by the Leapfrog Group.
Did Leapfrog indicate what might be driving that, or is it just a combination of all these different efforts on?
Yeah, good question. A big point was improved physician staffing in the intensive care unit, leadership in the safety realm, measurement capabilities and safety, feedback, intervention, things along those lines within that group setting, but primarily a lot attributed to order entry systems and EMR upgrades during that time frame. And so, yeah, it became a advanced, improvements in communication among systems and then leadership.
That's positive news. So for my headline, the Washington Post reports that more adults are taking sick leave than during the pandemic. And the reason for that they're giving is that more parents are needing to take time off to take care of sick kids. Right now, we've heard of that triple hit, the flu, RSV, and COVID-19 taking out large swaths of schools and kids under the age of 18, which has resulted in a increased spike. We're talking a significant spike in people needing to take time off. The last 3 years, there's never been more than 90 people per 1,000 people taking time off for sick kids. And in October, that crossed 100 people per 1,000, and it was still climbing at the time that they gathered this data. So here we are in the middle of November, and it's still climbing. Just anecdotally, I think we all know someone who's, all of their kids went to school and they got RSV or some other respiratory virus, and so this is putting a pinch on healthcare providers who can't be going into the office or into the clinic or into the hospital where they could be spreading these diseases too. And so we already had a crunch on staffing, and in the last month, we're seeing more staff have to take time off. There's not much we can do about it other than wait it out. But I thought this was a really fascinating problem that we're having that's just getting compounded every time we look.
Well, yeah, certainly very impactful to us all. So we have coming up Kristin Woodlock. Kristin is CEO of Woodlock Associates. And in this podcast, we start talking about leading during times of innovation, times of change, and the art of feedback, which I love how she phrases that, right? And we start talking about the 5 C's, clear as kind, things of that nature. So if you're a leader, wherever you are in your career, early on experience, what have you, this will be very insightful by Kristin. So very good interview we have coming up with her.
I'm looking forward to it. Well, Jason, we will see you next week.
Thanks, Aaron. Talk to you then. Hey, everyone. I'm Jason Crosby of Strategic Healthcare Partners and your host, along with Aaron Higgins. Today, we are joined by Kristin Woodlock, CEO of Woodlock Associates. Kristin, thank you for joining us today and welcome to the podcast.
Thank you, Jason and Aaron. It's terrific to be with you. I'm really excited to join this effort.
Yeah, Kristin, we're really excited to have you here. A few months ago, for the listening audience, SHP invited Kristin to come and speak to our organization. We were kind of facing a crossroads as we were determining some of our path going forward as a company. And Kristin really spoke to us where we were at, how to make some really difficult, complicated decisions in the process going into that. And we got so much out of her. We had to share her with the rest of the world. So, Kristin, thank you for joining us. Obviously, you talked to our company about change, and we're in changing times, right? We're just coming out of the COVID pandemic, and the world is suddenly new. How can companies really understand the difference between the leading innovation in their space and then change? Because we hear that all the time. Leaders of innovation. What does that mean, and how can a company understand that?
No, that's a great question, Aaron. I think this is so important. I have to tell you, I've been doing work in the field for well over 30 years in a variety of places. And I would tell you a year ago, I would have said, well, there really isn't a material difference between change and innovation. You need the same set of skills, maybe use them differently. And then I bumped into the work of Dr. Linda Hill from Harvard, and she really changed my thinking on this. And what she brings forth, I think this is just so important for teams right now in any kind of organization, is that change, when you're doing change, you really have a clear sense of what you're trying to do. So I think sort of for people who are in our space, the simplest example is like, we're going to have a new electronic health record, or we're going to have a new payment system, right? We know what it is. We know when it's going to work. We know all of these various things. And what I'm trying to do as a leader in my organization is be clear on, what it is we're doing and create followership to that. There's a pathway for it. And I think most people would tell you, if you use an electronic health record, it's not always linear, but we know what it is. We know how we do that. Innovation is just really different. And I do think after the pandemic, this is where we are. And so we don't necessarily have that really clear vision, but what we do have is a purpose. We have that why statement. If you follow Simon Sinek, we have that noble purpose. This is why we exist, and this is what we're doing. And leaders who are doing innovation are really clear in that and are able to bring their teams forward to really think about a co-design process, right? Where it's rooted in shared understanding of our purpose, and then a shared understanding of each of the various roles within the organization. And you're really trying to inspire that team to do that differently. And I know you both have huge leadership roles. Thinking I don't have a vision is a pretty scary thing. But I think if we're honest and we reflect on where we are post-pandemic, I think there's so much opportunity for innovation, but we can't necessarily have a blueprint that's really specific and at the same level of specificity with our electronic health record. So, thinking about those two things differently, thinking about the co-design of innovation, and thinking about also being really clear on your purpose are key strategies for leaders who are thinking about innovation.
I would say that the most daunting thing a leader has is where to begin. And I think that's where we were at earlier this spring when you met with us. We were looking at this mountain. We weren't sure. First off, we knew we wanted to get to the peak, but we didn't even know where the trail began. So I guess tell me about what you do. How does your organization help people find that trailhead?
First thing is to really come up with that purpose. And, what's interesting is sometimes I'll talk to groups and they'll say, well, we have a mission statement. And I have yet, there may be somebody in the audience who's had the benefit of this, but I have yet to go work with an organization where people can tell me their mission statement verbatim. It's on the website, it's somewhere. Maybe they get a couple of words. I can't tell you how many times people are like, I don't really know. So that to me is an artifact of the past. We really need to give our teams and our whole organization that noble purpose. Why do we exist? And we shouldn't be afraid of that. We should be able to dig deep on that and say, look, maybe we don't need to exist, right? What is it that really is special about us? And just to illustrate that, I mean, there are many why statements that you can find by using Google and typing in why statements. But two that really stick with me. One is Google's, which is to organize the world's information and make it universally accessible and useful. Like anybody at Google has a chance of repeating that, right? And like that can be an organizing principle, whether you are the CEO or whether you're the last person hired, to say, like, that's what I want you doing in your role. When you're thinking about what's the little cute artistic rendition of Google that we're going to put on there today, I want you thinking about that purpose statement, right? It just creates some glue for organizations. Somebody in my space, in working in the mental health space, used a why statement of people get better with us. And it was just phenomenally helpful for the organization during the pandemic. This group was in New York City, epicenter of the pandemic. People were out all over the city. And the one thing that they had when they didn't have any other information on COVID was that my purpose at this organization is that people are going to get better with us. So what do I have to do for that? Okay, I've got to make sure that we are washing our hands. I've got to make sure that they have milk. I've got to make sure, it just creates the glue and the stickiness. So first step is really go through that process to come up with your purpose. And it's not a mission statement, right? It's something repeatable. It's your essence of why you exist. It really helps you to think about that innovation front that we were talking about before.
Okay, so let's dial it in a little bit more. Obviously, there's the big vision statements, the corporate vision statements. What about me as a leader within the company? Maybe I'm starting a big project or something along those lines. How can we take those bigger idea principles and shrink them down to a more individual basis?
What is different, I think, if you are on this path of you know your purpose, you're in the innovation lane. A couple of things you need as a project leader, not even just the CEO, but a project leader. We need to socialize within our organization. If we are taking the innovation path, we have to understand that failures, face plants, things don't go as planned is part of the price of admission to doing innovation. Because we are experimenting, we're learning, we're figuring that out. Now I'm not talking catastrophic error, but really saying in the spirit of innovation, we're going to make some mistakes. We're going to have to, back the car up and go a different direction and know that going into it. That's something that's really important, I think, for project leads. And I think different, right? That may be another cultural element that you need to really give to your teams. The other is really skilling up in having what could be tough conversations around the innovation, right? The innovation may mean we stop doing something. The innovation may mean that our fiscal department has to support the physicians differently going forward, right? So they're in this innovation. We need to make sure that we have actually skilled up our folks in how do you not tap out of conversations when they get hard? How do you help people through when they're sort of stuck and we've always done it that way? And how do we really, really follow this moniker of clear is kind, right? That we are so often taught and told and raised to say that you just don't say anything. If it's not nice, don't say anything, right? I'm just so nice and polite. But in this business environment and in innovation, we have to be able to give each other feedback and we have to be able to really talk to people about what's going right and what's going wrong. And what we oftentimes do is we tap out because it gets uncomfortable physiologically and we end up going to somebody else and talking about that person, right? So clear as kind means as we're on this innovation project, we are clear about what our roles are. We're clear about how we're going to move forward. And if we are drifting a bit, we want somebody to be able to come back to the project lead and say, I'm not sure we're on track. And let me tell you why.
You've hit on what probably was my favorite portion of your presentation to our firm, Kristin, honestly.
Yep.
Clear as kind. And it's something we have actually talked about quite a bit, quite honestly, since that presentation. So
yeah, it's come up multiple times.
It's come up multiple times from staff all the way up to our principal. Because as you mentioned, sometimes there's hesitation in delivering a message that may sound confrontational of sorts, right? So if you don't mind, go a little bit more into clear as kind, unclear as unkind, and what you would tell a new leader when they feel like it's an obstacle to communicate in such a way. Dive a little bit deeper into that, if you will.
Sure. So, I think when we think about this, so clear as kind does not mean, Jason, that you and I are debriefing a meeting that we had, earlier today. And I come to you and I say, like, you were a real jerk in that meeting, right? You just talked over everybody. You didn't give it, man, you're intrusive. And it just killed the whole project, right? Like that might be clear, but it is not serving the work. So clear as kind to me means as a good team member, regardless of my hierarchical position in an organization, as a good team member, I'm committed to serving the work, and I'm committed to sharing feedback in a way that's focused on that work because I want it to work. I want us to do well with that. So Jason, I may come in to you afterwards and say, in that staff meeting today, as soon as you started talking about our project and then you linked it to the quarterly financials, everybody shut down. And I don't know if did you notice that? And you may say, no, Chris, I didn't notice that at all. Oh my gosh, that's not my intent at all. Yeah, well, I think we lost people on that. And, I think it just was perceived as being not mission driven and just bottom line driven. And I think we need to go back and repair that. And Jason, you may say, like, well, what do you think might work with that? And what might we do? Right. So, I know these feel a little bit artificial when, they're not like the big, problem that's staring at you. But I think that's how you look at that. Right. So I didn't in any way diminish your role as an executive within the organization. I'm just sharing that when you link that project to finances, there was a real negative, like dimming in the room. And that's not what we wanted. So how are we going to fix that? Right. So we keep it about what we're trying to do with the project. Like another one that I've heard, and I do work with the Brene Brown group. One of the ones I think she has just communicated beautifully is if you have somebody on your team, your project team, who just is always jumping in and answering, like before anybody has a chance to think about consequences and how things are going to come out, you've always got your sort of person who's going to answer. Clear as kind might pull that person aside and say, when we go into the operations meeting today, I really want you to sit back and let other people answer. Well, why? If I know I have the right answer, because I really want us as a team to work up some different muscles, and I want to hear from some different voices. And one of the things I really, really would appreciate you helping is asking those really detailed, great questions that I know you can ask, Aaron, and really try to pull information out of others within the meeting. I didn't come and say, you're overly talkative, you're getting in the way, shut up, right? Like that is not kind. That's not going to be helpful. But what I did was sort of talked about, I want you to sit back a little bit more and I want to hear from others. But one thing you can really help me with is asking questions. If you feel like you know the answer, ask some questions that might help us get to that answer, right? So you really have to come into it from the perspective of serving the work. And by the way, you also got to be ready if somebody, gets, you could have somebody get ticked off at you. You could have somebody cry. You could have somebody say, I'm done on this stupid project. So, remember, we are emotional beings. So when you're doing this, you just have to be prepared for that. And I think coming back to, I just thought this feedback was really important. I want this project to be successful. I certainly didn't intend to make you angry, to hurt your feelings. How can I fix that? That's not what I wanted to do. So let's talk about it a little bit more.
Now flip the table of that conversation. Communication being a two-way street, right? And we all have different personalities, personality types, et cetera. What maybe advice would you give to the person on the other side of the table who maybe has difficulty receiving that
what is perceived as unkind, but is actually trying to be truthful from someone else? Any advice to give to the person receiving the feedback?
I am totally reading between the lines and probably painting things, Jason and Aaron, with your team that may not have happened. But I loved what you said about after we started to have the conversation about clear is kind and what that can do to really create innovation and good communication within a team. You talked about how much you have talked about it, right? So I think it is very hard within a team or even between, a supervisor and a colleague, or a supervisor, somebody you're supervising, to just start in with this and not have had a conversation about, what, I've heard this really great thing that I want us to think about, and that is clear is kind. And let me tell you what's behind it. Let me tell you what that means. It's intended to serve the work, to give real feedback in real time to people, and for us together to come about like what's going to happen next. And I think if you create that culture and expectation ahead of time, it helps people when they tend to get defensive, reactive, they feel like you're criticizing me. So I would socialize that with my team. I really want us to show up this way with each other. And if I see somebody struggling, I'm probably going to reach out to that person one-on-one and say, whether I'm just a colleague, you don't have to do this in a hierarchical way, and just say, I see you struggling when we're really trying to deal with clear as kind. Is there something I can do? Can we talk it through? I did not hear Jason in any way criticize the work that you did on that dashboard. What I heard him say is that the data in the dashboard was making people on the team really judge each other. And so he wanted to take a different route at it. But that had nothing to do with how you created the dashboard, right? So sometimes you can give people specific feedback on where you think they're getting stuck, and it can help them through it. Again, regardless of where you are in the organization.
Do you think you mentioned how from the very first question about innovation and how different that's been just in the last year versus your first 30?
Yep.
Would you say communication and difficulty in communication has also been a little bit more difficult post, with pandemic, people work from home? There's a lot of talk of turnover, quiet quitting, all these types of things. Do you feel that's made things even more difficult, whether you're giving or receiving the message?
Yeah, it's interesting. And I do think it's important for your listeners to like remember that, I've had a very long career in like running large health systems and doing, even taking one large nonprofit into bankruptcy and, under a massive spotlight. So I've actually run stuff. What's been interesting to me as a consultant is in the first 5 or 6 years, did a lot of work, and the demand that people would come to me with was, I'm restructuring my health system. I'm bringing in different affiliates. Can you help me with that structure, with that process? It was very much about the business of behavioral healthcare or healthcare. In the last year or so, I just, my phone rings off the hook, or whatever the cool technology is of the day. I'm sure I have the latest tech. It's not a landline. I'm not that technologically backwards, but so my phone rings off the hook. I get the emails, and it's all about like, I need you to come in because like, I feel like my staff is burnt out. I feel like people are tired. Like all of my clinical staff want to work from home, but I can't make that work. We aren't having the tough conversations. We're irritable with each, like, it is so much about the ability to communicate with each other. How are we going to set up new norms? And really doing that. And what's been funny, Jason, I think, is I've started to work with some organizations, in particular using Dare to Lead, which is just one sort of tool in my toolbox. What I found is that it creates enough conversation, but then people start saying, well, yeah, well, we're Dare to Lead trained. Well, I didn't see Aaron show up that way. Jason shows up that way, but I didn't see Aaron show up that way. So there's just so much to unpack. And I think what I have really resonated and liked about Brene Brown's work is that she gives us very concrete tools and language, so that like clear as kind, right? That can be pretty simple, but that a team can sort of have a shared commitment to, have a shared understanding, skill up about how to give each other feedback and what does really engaged feedback look like, which is important. And also like if we're starting a new project, or I'm asking you to do something, this is another Brene Brown tool that I think is helpful on this emotional teamwork end. She'll say, make sure you paint done. So I don't just go to Aaron and say, get me the spreadsheet of all of our expenses that we've had with outside vendors for 2021. And Aaron's going to do the best he can to figure out what the heck is in my mind and what I'm going to do with it. Right. So he'll try, he's going to spend a lot of time really trying to, buff and polish something that looks really cool. But what I didn't tell Aaron was that I was really looking at outside vendors that we could potentially consolidate and look to group in a different way. And so I wanted to see some affinity elements of that. And I wanted to see who ordered them. And I wanted to see more detail on the invoice about what we actually purchased from them. So when Aaron delivers that product to me, I'm going to be like, this is not what I wanted. And Aaron's going to feel bad. I'm going to be mad because I wanted to share it with you, Jason, in 2 hours. And so what we really are trying to focus on this as well is me sitting down with Aaron and saying, like, I'd like those invoices. And Aaron says, like, pink done for me, Kristin, if I don't think to say it. And I'm like, okay, here's what I want to do. Here's why I want to do it. And Aaron might say, you know what, I know you're thinking invoices, but we actually have a better tool. I think if we look at our purchase offers and the purchasing system that we do, that's going to give us the information you want. And I think if I pull that together, it's really going to impress Jason in terms, okay, great, right? Let's do this. So really having that detailed communication and frankly, like, some people hate doing that. They hate spending the extra 15 seconds saying why you want it. I've even seen some leaders hate it because they don't really know what they want. Right? They know it, like, I know it when I see it, and whatever you give me here is not going to be what I want, right? Like, but if you can have that conversation ahead of time, it's amazing how much that streamlines the work. It gave Aaron a chance to show off a little bit to me about how he knows what's going on in the system. And he's like, yeah, all right, good. I really influenced this, right? And his work was actually productive instead of needing to go back and do it 2 or 3 times, right? So there are some little things that we can do as organizations, or we can take a bigger, more holistic approach. Like, I do work with some organizations who do Dare to Lead, like, across the whole organization, but you can do some little things that really help sort of tamp down some of the anxiety, angst, conflict, and can really start the team working together with a fresh set of energy. And I think that's what I heard you two describe sort of happened after I spent some time with your team.
So lots of very good applicable tools. As we wrap this up, what are some of the quick hit type things would you advise to, whether it's a new manager, right? We've got practice administrators, we've got hospital administrators listening. It's hectic, quick environments. Where can they go find some more information along the lines of what you just discussed and find you and maybe a couple of things as to what they can take back and apply in the near term?
They can find me at woodlockassociates.com. All the contact info is there. Folks that I'm following right now, I think the Dare to Lead podcast that Brene does on Spotify is just fantastic. Whether you're driving, walking, hiding in your closet, whatever you're trying to do, they're about 45-minute podcasts. She brings in amazing people. That's where I heard Dr. Linda Hill talk about the difference between change and innovation. I just think those are 45 amazing, re-energizing, informative minutes. So that's a really good resource. Brene Brown does have a website and has a bunch of freeware activities, including a daring leader assessment that you can take if you're just curious about sort of what some of your skills, skill spots, soft spots are. I think Simon Sinek's Start with the Why is really amazing in terms of getting to the purpose part of things. So I think those are some quick lifts I think that are out there that really would give you a lot, give the listeners a lot of things to start working on.
Fantastic. I'll tell you what, for those listening, do yourself a favor, go to Kristin's website, engage with her. The presentation you did for us, Kristin, whether it was the Clear as Unkind, the 5 C's, Dare to Lead, we went through all those tools. And as someone that, if you're doubtful, if you're fearful that there's fluffiness to the discussion, I'm here to tell you, no, this is one of those things where there's not as applicable tools in these applications that Kristin is talking about. So please, if you are looking for such an engagement, I would encourage you to do so. Kristin, I really, first of all, appreciated the presentation and thankful for the information today as well.
Great to be with you both. Thank you so much.
Yeah, thank you, Kristin. My only regret is that we didn't have more time. So we might want to have you back sometime here in the near future. So
sure, happy to come back.
Thank you for joining us. And everyone, thank you for listening to Vital Conversations with SHP. Again, our guest today was Kristin Woodlock. You can find her at woodlockassociates.com or Google her name. I did. I found plenty of ways to get a hold of her. If you want her to come talk to your organization, she's available for that as well. Alrighty. Thank you, Kristin. Jason, you both have a wonderful day.
You've been listening to Beyond the Stethoscope, Vital Conversations with SHP. This has been a production of Strategic Healthcare Partners. Your news hosts today were Jason Crosby and me, Aaron Higgins. It is produced and edited by Nyla Weave. Our social media content producers are Nyla Weave and Jeremy Miller. And our executive producers are Mike Scribner and John Crew. For more information about SHP and the services we offer, including the back library of episodes, episode transcripts, links to resources discussed, and much, much more, please visit our website at shpllc.com. Thanks for listening.
You already know that understanding your data is key to improving patient outcomes and financial performance. But how? At Strategic Healthcare Partners, our analytics services help turn your EMR and other data sources into actionable insights. From identifying areas for improvement to guiding you through implementing changes, SHP supports you every step of the way. Our performance analytics service dives even deeper, providing custom reports that help you stay ahead in the transition to value-based care. Unlock your data's full potential with SHP. Learn more at shpllc.com.